Welcome to Call Doctor podcast, where we explore topics that empower and educate. January is a month to focus on cervical and maternal health, two areas crucial for women's well-being. Today, we have a special guest, Dr. Shruti, a renowned gynecologist and expert in women's health. Doctor, we know this month is Cervical Cancer Awareness Month.
Yeah.
What is cervical cancer and why is it so important to raise awareness?
Okay. So see, cervical cancer is actually the cancer of the lower part of the womb, that is uterus. Now, why it is important to raise awareness on cervical cancer is that one, if we detect the cancer at an earlier stage, it is very much treatable. The second thing is the prevention which we have for cervical cancer is very, very good. Like we've got something which is known as HPV vaccine, and it really prevents quite a lot of people from cervical cancer. It is a very simple method of prevention, so why not do it? Another thing is that there is something which is used for screening for cervical cancer, which is known as pap smear or cervical smear. So, and that's also a very simple procedure which can be done in the outpatient department. It is absolutely painless. You do not need to pay any huge amount for it, and it can detect cervical cancer very early. And hence it is very important to raise awareness about cervical cancer because we have methods to prevent it, we have methods to screen it, and if we can diagnose it early, we have got the treatment which can actually treat it completely.
Doctor, how does HPV spread and what can we do to prevent it?
So HPV, as we know, is human papilloma virus. It is a virus which is sexually transmitted. That's well known. Now, when we say it is sexually transmitted, it can be transmitted by any route of sex. It can come through vaginal sex, oral sex, or anal sex. Now, human papilloma virus is actually a group of viruses. It has got almost around 100 subtypes, out of which 40 are responsible for any kind of genital cancers or head and neck cancers. Now, how do we prevent it? Or what can we do actually not to catch the infection? Number one is that it is sexually transmitted. So we have to go for protective sex. That is, we have to use barrier contraception, which is a condom, while doing any kind of sexual activity. That's one very important thing. And another way to prevent yourself from HPV infection would be HPV vaccine, which we will be talking about shortly. And the next thing would be to keep your immunity high up, because HPV is a virus which is self-limiting. Your body has got a capacity to fight against it. If you've got a good immunity, you can fight against the virus.
Perfect.
Yeah.
Doctor, let's talk about HPV vaccine. Can you tell us how does it prevent cervical cancer?
Okay. So HPV, as I spoke just now, that it has got almost 100 subtypes. Now, when we talk about the HPV vaccine, the vaccine will help you to protect from certain strains of the viruses. Now, 3 types of HPV vaccine have been available in the market. The first one is Cervarix, the second is Gardasil, and the third is Gardasil 9. So, Cervarix protects you against the strain 16 and 18. Now, 16 and 18 are the high-risk type strains of HPV, which are responsible for causing around 80 to 90% of the cancers. Gardasil will protect you from 6, 11, 16 and 18. Now, 6 and 11 are the low-risk types, which are responsible to cause warts. So, warts are basically painless bumps which can happen in the genital area or close to back passage. Gardasil 9 protects you against 9 strains of human papilloma virus. So, that's the best vaccine which is available in the market right now. And it protects you against 6, 11, 16, 18, 31 and so on. So, when it protects you against these strains, you get a protection against the HPV. So that's how an HPV vaccine works. It's a recombinant vaccine and it helps you to contract the virus.
Perfect, doctor. And what should be the schedule like for the HPV vaccine?
Okay. So when we talk about the HPV vaccine, it can be given to girls and boys both. I would like to emphasize the fact over here that it is very important for boys also to take the vaccine. Because if we vaccinate all the girls, that would not help. Because as we understand, it's a sexually transmitted infection. So they would definitely get it from the boys. So that's important. Now, it can be given as early as 9 years of age. However, it is usually given between 11 to 12 years of age. Can be given up till 26 years. Now, it has got schedules. So, if it is given less than 15 years of age, we usually give it in 2 doses, which are around 6 to 12 months apart. UK has even recently shared a guideline wherein they say that even single dose is as effective as 2 doses, but there are a lot of countries which are still giving 2 doses. After the 15th birthday, you need to take 3 doses. Like first dose if you take today, the next dose has to be after 1 to 2 months, and the next has to be after 6 months from the first dose. So that's how 3 doses are given. It is an intramuscular injection which is given in the deltoid, in the upper arm. Usually doesn't have too much of side effects, but there can be a little redness, or if you are hypersensitive to yeast, then probably you're not supposed to take the vaccine. Or if you're going through a very, very severe illness, so then you're not supposed to take the vaccine. It can be given to anybody less than 26 years of age. Nowadays, we're also giving it to women between 26 to 45 in case they're not adequately vaccinated or in case they're high risk.
Doctor, can you give us few tips to maintain a good vaginal health?
Okay. Now, this is also a topic which needs to be really understood by a lot of people, because one, we need to understand that vagina has got a capacity to cleanse itself. Now, what most of the women they do, they try and keep cleaning the vagina quite a lot. That's a very important thing to be understood, that repeated cleaning is not good for vagina. Vagina is always full of bacteria. The good bacteria, which is lactobacillus. Now, if we keep cleansing it, we will also be losing the good bacteria, which is providing immunity to us. So the first and foremost thing is not to over clean yourself. So what you're supposed to do in the morning when we go for a shower, at that moment we are supposed to wash ourselves very well, not to use a soap, because the soap changes the pH of a vagina. In case you really want to use it and you're not comfortable without it, you can use a very mild soap. No talcums, detergents, tissue papers, scented tissue papers, and vaginal washes. Absolute no to vaginal washes, because they do change the pH of the vagina. Now, whenever a woman goes for urination, it is important to just sprinkle water and dab yourself dry. Another important aspect is that all of us should not put a finger inside the vagina and then try and cleanse it. That's another important thing, because it can cause trauma and it can also change the pH of the vagina. To use cotton innerwear is very important, because it actually absorbs the sweat and it prevents the fungal infection to happen down below in the intimate area. Another things which are important for a good vaginal health is a good balanced diet. All of us should take good probiotics that help us to actually build up a good vaginal flora. So these are the important things which should be taken care of. Sexual hygiene is very important. You need to wash yourself very well after a sexual activity. It is important that urination should be done after sex, because it helps to flush out the bacteria. If anybody is sensitive to condom or any kind of spermicidal jellies, then you have to take care of that, and you have to make a note of it, and you should not use all those things.
Doctor, what do you think about probiotics, and does it help vaginal health?
So basically, as I said, that vagina is full of good bacteria, which is lactobacillus. Now, probiotics, they contain lactobacillus. So if you will take probiotics, you're actually helping build up the good bacteria in your vagina. Now, it is not important, it's not always that a woman does not have good bacteria. So I think what is advisable is that you speak to your gynecologist, you meet your doctor, you make sure what kind of vaginal flora is there in the vagina, which is possible to do with the help of a high vaginal swab, and depending on that, probiotics can be advised to you. Like, suppose if your vagina is full of lactobacillus, so already it's very healthy. You might take probiotics for prevention, but it is not going to treat anything as of now. But in case your vagina, the lactobacillus is being replaced by the anaerobic bacteria, which is responsible to cause bacterial vaginosis, in that case, yes, surely probiotics are going to help. So that's how it usually helps the patients.
Talking about maternal health, how often should we have a prenatal checkup, and why is it so important to do?
So when we talk about prenatal, it's very, very important because as we understand, if we are healthy, we embark onto a healthy pregnancy. So now, for example, suppose if somebody has got some medical illness like diabetes, high blood pressure, asthma, thyroid, if you see an internal medicine or your general physician, you are able to control those particular diseases. It is important to embark onto a pregnancy with the diseases which are well controlled rather than an uncontrolled disease. Similarly, there are a lot of medicines which are not baby friendly, and if you get pregnant while you're on those medications, they might have some kind of they might cause some kind of congenital defect in the baby, or they might cause some kind of abnormality, So that is why it is important to convert the medicines into baby friendly medicines.
Right.
That's another important aspect. Then coming to immunizations, like suppose if you see a doctor prenatally, you can make sure that you're adequately immunized, like specifically for rubella, so that you are not at high risk of catching the infection of rubella, which is actually very dangerous to the fetus because it can lead to a lot of congenital abnormalities. Then coming to if you're overweight, if there's a woman who's obese, it is not very healthy to embark onto a pregnancy when you are overweight. So that's important that the weight needs to be reduced because you are able to prevent a lot of complications if you reduce your weight and then you embark onto pregnancy. Coming to alcohol, smoking, or any kind of recreational drugs. So if you are smoking, then it can lead to a growth restricted baby. Recreational drugs can also harm the fetus. Similarly, alcohol can lead to an alcohol syndrome. So that's why it's important that all these smoking and alcohol should be stopped. Coming to exercises, a good diet, stress relieving things. So all these things needs to be done in case you want to get pregnant. Then folic acid needs to be started, which is a micronutrient. It prevents neural tube defect. So that also needs to be done. And hence prenatal checkups are very, very important.
How does micronutrients really help a healthy pregnancy?
So actually there are few micronutrients which are very, very important for a healthy mother and a healthy fetus. Talking about folic acid first, folic acid is a micronutrient which is required 3 months before a woman gets pregnant, and it should be taken for the first 3 months of pregnancy. 400 micrograms of folic acid is mandatory. There are certain conditions in which we might need an additional dose. That's a higher dose, 5 milligram, like if a woman is diabetes, if she has a history of neural tube defect in the past. So folic acid prevents the formation of structural defects, which are neural tube defects. These are the defects in the backbone and the brain of the baby, and it prevents such defects. So that's one. Talking about vitamin D, 400 international units of vitamin D is mandatory for a woman who's pregnant. Vitamin D helps, as we all know, it helps to strengthen the bones of the mother and the fetus. Nowadays, it has also been found to reduce the risk of diabetes mellitus and hypertension in pregnancy. Coming to calcium, we know that calcium also helps in building up bones for mother and baby. 1000 milligrams of calcium should be supplemented to a woman who's pregnant because it is difficult to supplement that with the help of diet. Iron is another micronutrient which is very important. It helps in the growth and the development of the baby. If iron amounts are not adequate, it can again lead to intrauterine growth restriction. And as we know that pregnancy is a state of hemodilution, if iron amounts are not adequate and you lose quite a lot of blood during childbirth, it can be dangerous. Then there are a few other micronutrients which are important for a pregnant woman to be taken, and when we prescribe supplements, they contain minimal amounts of the nutrients like copper, molybdenum, then iodine and chromium, magnesium. All these supplements are to be required, and they're all important for the growth and development of the baby.
Doctor, could you explain about NIPT test? How does it help?
Okay, so NIPT, the full form of NIPT is non-invasive prenatal testing. It is actually a prenatal screening test which is done from maternal blood. It can be done as early as 9 weeks of pregnancy until the baby is delivered, but as early as 9 weeks. Now it is how it is done. 10 ml of maternal blood is taken and fetal DNA is extracted out of that maternal blood. The chromosomes are studied, and then it is helped to understand if there is any chromosomal abnormality in the baby, specifically for chromosome 18, chromosome 21 and chromosome 13. That is Down's, Edwards and Patau's syndrome. Chromosomal abnormality 21 is the most common abnormality which has been found, and it is a very, very good test, and it is highly accurate to diagnose or detect not diagnose exactly because it's a screening test, but to detect Down syndrome. It will also help us to know the fetal sex because it looks at the chromosomes, and it would also help us to look at the sex chromosomal abnormalities. So this is what NIPT does. But what needs to be understood over here is that it is just a screening test and it is not a diagnostic test. In case NIPT, the report of NIPT, patients usually get scared because they feel that it shows either low risk or high risk. NIPT would never tell us that whether the baby has it or doesn't have it. It will only show the risk. In case the NIPT shows that there is a high risk, we need to go for diagnostic modalities like amniocentesis and Corion-Willis sampling, wherein we take fluid around the baby and send it for karyotyping, or we take small amount of placental cells and we send it for karyotyping.
Doctor, other than NIPT, do you suggest any other prenatal checkups?
Yeah, so NIPT is the best one which is available in the market right now. However, we have got other tests which can be done like double marker, triple marker and quadruple. Now, double marker is something which is done between 11 weeks and 13 weeks and 6 days. It is again a blood test, but here the hormones are checked. That is beta HCG and PAP-A in double marker. So looking at the values of the hormones, collaborating it with the maternal age and the ultrasound done at 12 weeks, they calculate a combined risk. That if the baby has got a higher risk of developing any kind of these syndromes, that is Downs, Patau's or Edwards, or at a low risk. Again, it's a screening test. It needs a diagnostic test in case it comes positive. Triple marker is done somewhere between around 15 to 18 weeks of pregnancy. It checks 3 hormonal levels, and quadruple checks 4 hormonal levels, which is done between 19 to 20 weeks of pregnancy. These are all blood tests. They check the hormones in the mother, and depending on that, they calculate the risk of the baby developing these syndromes.
Stress is very common in pregnancy, right? So what will be your suggestion to manage it?
Okay. I think the first and foremost thing to manage stress would be to embark onto a healthy pregnancy. The less complications, the less stress. That's the first thing. So I would suggest to please see your doctor as a prenatal screening so that you embark onto a healthy pregnancy. That's the first and foremost thing. Second thing is choose a gynecologist who's very close to you and can listen to you, because that's very important. If you can speak to your doctor and you can share your concerns with her, that definitely eases down your stress, because most of the women, when they're pregnant for the first time, they are not aware. I mean, it's completely a new thing for them. Some of them are not prepared for it as well. So if you have a doctor you can really reach up to, it helps you. Another important thing is that small things can help actually. Like, you have to just make sure that you do certain activities which help you to relieve your stress. Like, you can just listen to good music. You can start journaling. You can write a journal. You can meet your friends quite often. You can go out for outings. And you can start doing some small amount of yoga. 10 minutes of meditation helps. You should not follow a sedentary habits. I mean, you should, even if you're at work, you can just get up, go and speak to a friend, go and get a glass of water or a cup of coffee. That also helps. Then going for a walk helps, because when your eyes see different kinds of things in the nature, it definitely eases down your stress. Reducing coffee intake, reducing tea intake, that also helps to reduce down your stress. Involving your partner in all the antenatal checkups, trying to take some antenatal counselings, some antenatal exercises, doing everything together also helps to get rid of the stress. So these are few activities which can be done by a woman when she's pregnant to, get rid of stress.
What would be one piece of advice that you would like to give to all women out there?
One piece of advice which I would like to give would be that always be happy. Never leave your house without a smile on a face and without wearing your confidence. I think own yourself. That's the best thing you can do to yourself.
What is the best part of being a doctor?
For me, I think the best part of being a doctor is that I get to see so many, specifically I would say being a gynecologist, I love to see women and, to actually listen to their journeys, whatever they are going through, and then to be a part of it. That's very, very important for me. I think I've made so many patients as my friends in this journey, and this is something which I really love to do.